Hello. Hi, everyone. A warm welcome to everyone. Happy International Women's Month. As part of International Women's Month, we are celebrating womanhood by embracing the equity with our webinar. Thank you for joining today's webinar and for your support. Myself, I'm Deepthi. I'm serving as BOD from Charlotte. We from webinar team. Vijay has chosen this topic for today and he's playing a vital role in driving the session. And Srikant Amidala, who is also serving the webinar committee, is taking care of the live streaming and behind the scenes. And we have our EC executive members here and the president, and Srinivas Saini, he is representing this meeting. With that, I want to give some quick logistics about this session today. It is an uninterrupted session. We'll hold up some questions and answers that will be answered at the end. With that, let's get started. So here is our presenter, Dr. Jessica Saran. She's an optometrist, doctor of optometry, and today's topic is eye health. We all know that there is a saying in Telugu, Sarvendriyanam Nayanam Pradhanam. That means our main focus is towards to protect the eyes. So I welcome Dr. Jessica Saran. Jessica is an optometrist and a doctor of optometry. She born and raised in Michigan, and she knows Punjabi and Hindi. And she's a licensed eye care expert with significant skills and experience in performing the problem-focused and primary vision care examinations. Jessica, currently she's working in the full-time with Lens Crafters, telemedicine for the past 1.5 years. Before that, she was in a private practice for 3 years. She graduated from optometry school in 2018 from the Ohio State University College of Optometry. For undergrad, she went to UOFM, Dearborn, Michigan. And today we are going to learn some interesting things, that is common eye conditions and the systematic diseases and their impact on eye health, and children's ocular health in the digital world. And we are going to learn about the screen time and its harmful impact on everyone's eyes. And we also learn how to protect our eyes. And we also have our NAPA president and executive committee secretary in the call. And thank you for joining, everyone. I request everyone to be on mute. And for any questions, please raise your hand. And however, I request all to ask questions at the end of the session. With that, I welcome Dr. Jessica Saran to start the session.
Thank you so much, Deepthi. Are you guys able to hear me okay? Just give me a thumbs up, Deepthi, if you can.
Yes, please.
Okay, perfect. Well, thank you for the warm welcome, Deepthi, and thank you for everyone for tuning in. And please, like Deepthi said, we welcome any and all questions too. So we'll go ahead and get started. So again, my name is Jessica Saran. I am an optometrist, and I'm hoping today to just give you a little glimpse of some basics of eye care and hopefully give you some tips and tricks that you can start to apply in your real world today too. So for those who are curious, how do you become an optometrist? So number one requirement is you need a high school diploma. And then you go on to get your undergraduate degree. That's typically a 4-year course at most of the undergraduate schools. And then you go on to optometry school for 4 years. So in optometry school, there is no residency required. You are a doctor of optometry after the 4 years, and you can start to practice in, primary vision care. If you wanted to do a residency, though, you can, and you can specialize further and get more exposure with pediatric eye care dealing with children. Low vision is a specialty that deals with patients who no longer are able to see, 20/20 vision due to some disease that is affecting the eyes. And so they may need some additional tools and instruments to help them optimize and maximize their vision. So that's what low vision is. Vision therapy is another subspecialty within optometry. So just like there is vision therapy or physical therapy for any muscles that you might have issues with in your body. Let's say you pull your bicep or something and you have to go to physical therapy. There's actually vision therapy too, because the eyes are a set of muscles that may not be working well together anymore, or they may become overworked. And so they need some extra help getting back into working together as a team better. So that's vision therapy. And then of course there's disease management. So you may have heard of things like glaucoma or macular degeneration or diabetic retinopathy. So there are optometrists that specialize particularly in only seeing disease-based patients as well. That's a little bit about, other pathways to get to optometry and after you're in optometry, okay? Now, another common question that people often have is, so what is the difference between an optometrist and ophthalmologist? So a little bit of a difference here is that ophthalmologists are actually going through medical college. So they are MDs. So they do their first 4 years of training in the medical school versus the optometry school. And then they go on to further specialize. And they're the ones that are going to be doing more of the surgery. So they will be the ones that you might be seeing for something like LASIK or cataract surgery. And so they have an additional 4 years of training where they are specializing in those things. And then the optometrist, like I explained, we are the doctor of optometry. We go through those 4 years, and then we are doing all of the primary vision care. So glasses, contacts, and disease management up until typically it gets to the point of needing surgery. I won't bore you too much with reading off all of this content on this slide, but I provided it for those who are curious. This is a basic eye anatomy to get you just familiar. We have the white part of the eye, or the sclera, and so that's like the tough layer that's going to provide the protection of the eye. The iris is the color part. So for most of us, that is really dark brown. I know some people think they have black eyes, but it's actually really, really dark brown eyes. So that's the iris, and that's going to act like a camera aperture, where it's going to control that pupil size, which you can see is that black center dot in the middle. And that's what's controlling how much light is entering your eyes. So typically, when we're in bright light environments, like if we're outside on a sunny day, that pupil size is going to get smaller so it can limit extra light getting into the eyes. And then usually when we're in the dark, that pupil size does get bigger so it can maximize the amount of light entering your eyes, okay? And then the ciliary body is just a muscle that's located behind that iris that you can't see here, and you can't see it with the naked eye. But that's the muscle that is controlling your eye's ability to focus in on things. And then we'll talk a little bit later on about how that muscle does age and lose its flexibility, usually somewhere around age 40 for most people. The lens, again, you can't see with the naked eye. It sits behind the iris as well. And that is where, things like cataracts develop. And so that is what is focusing light all the way back through to the retina where the images are focused, okay? And so that takes us all the way back to that last layer, the retina layer, and that is where the light is actually being processed as an image, okay? And so, different types of refractive error. So refractive error is basically when your eye shape prevents you from being able to focus light directly onto the retina. And so this might be occurring for a different, reasons. It can be from genetics. So if your parents have some sort of refractive error, then you are more likely to develop that at some point in your life as well. They're showing that environmental factors also do play a role. So lack of sunlight exposure early on in childhood, or if you're spending too much time doing up close work, that's your tablets, your iPads, all of that can actually contribute to some refractive error as well. Of course, if there's diseases happening in the eyes like cataracts or keratoconus, which is a thinning of the corneal surface, that's going to impact your refractive error as well. Aging, so there are things that again come on in our 40s and so forth that will impact refractive error. And of course, if you've had or injuries, that will play a role as well. And so overall, you know, refractive error, which we're going to get into the types of those in just a second, but those are something that is multifactorial. So it is a combination of your genetics, your environment, and of course, other disease processes or aging effects as well. Okay. And so here, one of the most common types of refractive errors is myopia. So that is also called nearsightedness, and that affects 40% of the population. And so basically, that is when your eye is actually too long. And so the image is focused in front of the retina. And so you're seeing things blurry for far away. So nearsightedness means that you can see up close, but you cannot see far away. And this is the result of the eye being a little too long. And so how we correct for that is minus lenses. And so that's when you might have like a minus in front of your prescription at times. Okay. This is genetic largely. So typically, if both parents have it, then you have a 50-50 shot of developing this. If neither parent has it, it's more of a 1 in 25 chance of developing it. And another, refractive error is hyperopia. So this is where things far away are clear for an individual, but things up close are a bit blurry. And so this typically happens when the eye is actually shorter. And so the image is getting focused behind the retina. And so we need some plus power lenses to bring that into focus. And this affects about 10% of the population. So another, common, refractive error that we see that a lot of people, they might make it their whole lives until they're like 40, 45 years old. And then all of a sudden they can't see their phone and they look like this guy, they're trying to like either remove their glasses that they might be wearing for distance, or they're just like extending their arms out, trying to get things into focus. And that is, they're experiencing what we call presbyopia. And so that is sort of like how this diagram is showing, where things far away will be clear and things up close will not be clear anymore. And that, like I said, it typically happens for most people in their 40s, or some people might get to 50. And that is losing flexibility in the lens and that ciliary body muscle that we were talking about earlier. So losing flexibility will cause this to happen in that muscle, okay? Another refractive error that often is, underdiagnosed because a lot of people don't realize that they have this is astigmatism. So that's when the front surface of the eye, instead of being a perfectly round basketball shape, it's shaped like a football instead. So not that drastically, but a little bit oblong instead of being a perfect sphere. And so what happens then is light is actually focused like at two different aspects in the retina. And so we see sort of like these diagrams are showing you, you're going to get more doubling images. You're going to get some shadowing of images. You're going to get more glare and halos with nighttime driving. Okay. And some people, they go so much of their life without realizing that they have this refractive error, because they don't realize that the way that they're seeing is not as clear as they could be seeing, because they're just used to seeing that way. And so oftentimes they'll be squinting and trying to get things into focus at times, and then at other times they can see perfectly fine, but they don't realize it because their eyes are just overworking themselves trying to get those things into focus. So 1 out of 3 people do have astigmatism, but like I said, a lot of people don't realize it until later on in life, when their eyes are just gotten so tired of overworking. So just to kind of visualize, again, to, show people who may not have any refractive error, how things look for the people that do have it. Okay, so of course you can see the normal vision there. Everything's nice and clear. And then you see that person with myopia, where the things up close are clear, but then off at the distance, things are not clear anymore. That astigmatism correction, where you see just shadowing and things are just not quite into focus at all ranges of vision. And then, of course, there's hyperopia there, where things up close are a bit blurry and things far away for those people are going to be nice and clear. Now, how do we correct refractive error? So the most common way is going to be, glasses and contacts. So glasses are a very common and effective way. So they're going to put your lens, your prescription into those glasses to help you be able to see, just like that first picture on that previous slide, everything nice and clear. Okay. The other option for somebody who doesn't maybe want something on their face is contact lenses. So instead of sitting on your face, it's going to sit on the cornea, which covers that color part of the eye. Contact lenses do require, cleaning and maintenance. But they are able to correct a lot of the refractive errors that people face today. So they can correct myopia, hyperopia, but they can also correct astigmatism and presbyopia too, with multifocal contacts as an option as well. Now, these are also ways to correct refractive error. They just might be, slightly less common than getting glasses or contacts, but definitely procedures like LASIK, PRK, SMILE, those are all options to correct your prescription if your corneal surface is nice and healthy to operate on. And of course, if you don't have any underlying issues that might make risk factors for these greater as well. And then there's actually ortho-K lenses, which actually work overnight. So you're wearing the contacts overnight. It's typically a hard, rigid lens. So it's going to fit on your eye and then warp the corneal surface so that you don't actually need something during the day. Again, these lenses are going to need, maintenance and cleaning, but it can be a really good option to help also slow down myopia in some children as well. So this can be an option for most people. All right, let's talk about kids and eye care. So, there are studies being shown that kids early on that do spend more time outside rather than spending it doing near work activities, which can be, reading or using some sort of device, they are going to be less likely to develop myopia, which again is where people can see up close, but not far away. And so, like I said, there are studies that show that people who are spending more time outside are less likely, and people who are spending that time earlier on in childhood. So the exact age limits, they have not been able to pinpoint, but they're doing further research. But it is a given that if you're spending more time outside earlier on in childhood, it is decreasing your, risk for developing myopia. Of course, there's still going to be that risk if your parents had it, but this is that environmental factor that we can somewhat control. All right, so how much screen time is actually recommended for children? So, with research, they're showing that really kids shouldn't have much screen time younger than 2 years old. Video chatting with family and friends, that's okay, but really they shouldn't be just like handed a tablet to play on for a couple hours a day before the age of 2. Although the kids are really smart and they can, pick up those games and just like get into things on their own, they really shouldn't be doing that for, again, the development of their eye and the risk for myopia development going up. And then even after 2 years old, up until 5 years old, when they're really starting school, they really shouldn't be having more than an hour a day of screen time to, again, reduce that risk of myopia there as well. And then, 5 through 17, trying to limit it to 2 hours, a day is really going to provide the least amount of risk for not only myopia development, but just digital eye strain as well, which we will get into in just a little bit here. Another thing to think about, and oftentimes people don't realize, is, hey, when should I be taking in kiddos to get their eyes examined, right? Are we waiting until they're actually complaining like, hey, Dad, I can't see the board at school? Or, saying, you know what, I'm getting headaches after reading my book. No, actually, we should be going in well before they're able to even tell us that something's going on. So really, kids should be having their first eye exam between 6 and 12 months of age. And you might think like, well, what are they going to find then? They're actually able to find if your child does have any signs of hyperopia or myopia possibly developing that they may grow out of by age 5, but it's important to know how much they might be picking up on to see, if there is a lot of minus power still being found at that first exam. You may want to, take into consideration more time outside and less screen time and things like that. They're also going to pick up on if there's any eye turns happening in the child, or if there's a lot of astigmatism correction or even hyperopia or myopia in one eyeball and not the other, then they may develop something what we call a lazy eye or amblyopia, which we'll get into a little bit later on as well. But that's another thing that can be caught at an early stage. So there's a few different reasons, and of course for the overall health of things, but there's a few different reasons to take in your kiddos before they're even 1 year old. And then somewhere, between 3 and when they start school, it's recommended to take them in again. Because again, they might be growing out of some of that hyperopia that they might have found at their first exam and so forth. And then of course, I would take them in annually after they have started school. And so amblyopia is one of the things that can be caught early on, and it's called a lazy eye. But really what it is when one eye does not develop visually as the other eye is, because the brain is going to favor the eye that it can, if it has reason to. If both eyes are not seeing the same, it's going to favor the one that can see clearly. And so, two big things that can lead to amblyopia is strabismus is one of them, and that's a misalignment of the eyes. So that is when one eye might be turning in or out or up or down, and the other one remains straight. So it's always focused in on images, and the other one, if it's going out or in or up or down, it's not going to be clear focused on images. And so the brain's going to favor the eye that can see clearly. The other one's going to start to lag behind. Then when you go in for an eye exam, they will not be able to correct that eye fully if it goes untreated for too long. If it's a simple thing like a refractive error, and if it's caught early on, they may still be able to give that correction to that eye and give it what it needs so that it can fully develop. So the brain says, okay, now I can see clearly in this eye, and I can still see clearly in this eye. So now both of them will still be able to correct a 20/20. Whereas if it goes ignored or it's too long, then we will no longer be able to see 20/20 in that eye that may have the condition. Of course, things like cataracts or just a family history of amblyopia can lead to amblyopia as well. All right, now let's talk a little bit more about digital eye strain. So a lot of our world now is spent in front of some sort of screen, whether it's a computer, a phone, a tablet or iPad, just like all of you are, tuned in via Zoom, via some sort of device. Our world has just become more and more digital and on a device. And so a lot of times people who are spending even as few as 2 hours a day can start to develop some of these symptoms, and they may not realize what it is and what's causing it. So, digital eye strain can present as just eye fatigue and discomfort. Some people do get headaches, blurry vision, double vision, your eyes just kind of feeling dry or irritated. Some people start to have neck and shoulder pain with digital eye strain as well. So this is just some of the symptoms. And let's talk a little bit about the causes. So it's not just simply, the time spent, excuse me, it's about how you're spending that time too. So if you're just sitting there for 8 hours a day without taking regular breaks, that's going to be playing more of a role than the person who is taking regular breaks. Also, just time without breaks looking outside at natural light can make it worse as well. And paying attention to your posture. So posture, how you're sitting up straight versus hunching over, without proper back support, or if you're having poor lighting. And if there's also pre-existing vision problems, like I was saying, the astigmatism correction, or if you're developing presbyopia and you actually need to be wearing glasses to help you see better, and then you're spending all this time in front of a computer screen or a tablet, well, that's just making the problem even worse, because now you can't see clearly, you're adding in all this screen time, and it's just causing a lot of strain on your eyes, okay? And so what are some things that we can do to help with this? So one is, a big one is following the 20-20-20 rule. So that is where every 20 minutes or so, you try to take at least 20 seconds and look at something at least 20 feet away. What that's going to do is relax your eye muscles that are starting to work in on overtime when you're looking at things up close. So that ciliary body, that lens that we were kind of talking about earlier, those two muscles are working in on overtime when you're looking at things up close. When you look at things far away, they're going to relax. And so that's important, because if we're constantly overworking them, it's like a muscle anywhere else on the body. It can go into a spasm. It can cause some strain, right? And so that's where taking those breaks comes into play. Other things that you can do is just adjusting the computer screen settings or your phone settings. Using warmer tones will help reduce blue light. Oftentimes now all the phones have the blue light settings, so utilize that. Adjusting the brightness so that it's comfortable for you too. So if you're in a dark room, you don't want the brightness turned all the way up. You want to try to keep it below 50% to, again, reduce that strain on the eyes. Using glasses with a blue light filter can also help, whether that's with your prescription added in there, or if you don't have a prescription, just adding a blue light filter glasses to your everyday routine can be helpful. And then we've talked about this 20-20-20 rule. Also, when you're taking that break, taking 10 really big exaggerated blinks can be helpful, because what that's going to do is replenish your tear film. So oftentimes when we're staring or on a screen, we do tend to stare and we're not blinking as much. Blinking is what replenishes the tear film on our eyes, so our eyes are not feeling as dry. And so every time you're blinking, that's helping. But when you're staring, the tears evaporate and then they're not getting replenished fast enough. And that's what's causing your eyes to feel dry and maybe irritated too with increased screen time. So taking exaggerated blinks can just help reset that, or using artificial tears. Something that's preservative-free and chemical-free would be useful as well. And then improving your posture. So, sitting with your shoulders back instead of hunched over, trying to keep your feet flat, and trying to keep your computer screen at or below eye level. So if it's above you, you can, cause some more strain on your neck as well that way. Okay. So again, this is kind of reiterating that 20-20-20 rule and other things that we can do, modify your workspace and trying to use one device at a time. And of course, consult your doctor because there may be some underlying prescription that needs to be added into your glasses, or there may be, just underlying dryness that is making it worse with the digital eye strain. Okay. So other things in eye care. So systemic eye diseases. So oftentimes people don't realize that the only place where you can actually visualize blood vessels in the body is your eyes, and that's the back of your eyes. And so this can be sort of a window to the rest of your body. It can show us signs of diabetes, high blood pressure, certain autoimmune diseases, thyroid issues. And sometimes they're picked up before people would even, maybe catch it. Let's say they're not somebody who's going to the doctor regularly and they do have diabetes. We can start to see signs of that in the eyes with bleeding and swelling of the blood vessels. So this picture sort of demonstrates, what a normal retina would look like, which is the back surface of your eyes. And of course, this is an extreme case of diabetic retinopathy, but even small changes like any bleeding and swelling can be picked up with your retinal vessels. The other example of this picture here just shows a simple illustration of just something like how arthritis can affect the eye. Those are a list of things that can be caught in the eye with something like arthritis. And like I said, other autoimmune disorders and thyroid conditions can all show up in the eyes as well. So it's very important to get your eyes examined regularly, annually, for a number of reasons, so not only are we detecting systemic conditions with that, but we're measuring your refractive error, right? So we're looking for any myopia, hyperopia, presbyopia, or astigmatism that might be present in the eyes to get you seeing clearer and better. We're checking your eye pressures. So just like you can have high blood pressure, you can also have high eye pressures as well, which could warrant, treatment or could be a risk factor for something else like glaucoma. We will also be able to evaluate the health of the front surface of the eyes and pick up on any inflammation, dryness, cataracts, those types of things, and also evaluating your retinal health, which was your blood vessels and other things that can show up like glaucoma or macular degeneration as well. This picture here up and to the left just illustrates, what we see when we get a dilated eye exam. Oftentimes people may ask, do I have to get dilated? I really don't want to. It's going to make my eyesight blurry for the next couple hours. I've got too much work to do. Can we just skip it? I would say it's very important to get your eyes regularly dilated because, as you can see here, we just get a very narrow snapshot of your retina if you're not dilated. And if you are, we're going to be able to pick up on a lot more surface area of the retina, which is going to help us, again, evaluate for any other systemic conditions or any little holes or tears that might be happening in your retina as well. And so little eye care tips and tricks that you can apply to everyday life to keep your eyes nice and healthy, right? So eating a well-balanced diet that's going to have colorful fruits, omega-3s, green leafy vegetables, all of those are going to help maintain good eye health, okay? Wearing sunglasses to protect your eyes against extra UV damage will help reduce the risk of things like cataracts or macular degeneration from showing up earlier on in life as well. Taking regular breaks, of course, as we talked about, to reduce your digital eye strain. And then just getting regular eye exams, like I said, with the dilation will help us as well. Your hydration level will also play a role in how your eyes feel less dry and irritated, your ability to produce enough tears for your eyes to feel comfortable. Of course, avoiding smoking will decrease the risk of things like cataracts and macular degeneration as well. Getting regular exercise will also promote good macular health. and of course, getting enough sleep. That's going to help your eyes just feel refreshed and ready to go for your day when you're ready to use that, that screen, that iPad and stuff. Being well rested is definitely going to play a role in how quickly your eyes might start to feel tired as well. So again, these are little tips and tricks that we can apply to everyday life. Okay. Just ending with a little humor here. So a couple of jokes in relation to today's topic. And then thank you for your time, and thank you for everyone tuning in. And then I guess we'll take some questions now.
Sure, Jessica. Thanks for your presentation.
Mm-hmm.
Glad we learned so many new things today.
Awesome. I hope you guys found it useful.
Yeah. Here is a question from Arun Sirimalla. He's asking, like, does all types of astigmatism are corrected by lens?
Yes. So astigmatism correction, yes, it can be corrected with either glasses or contacts. People who undergo LASIK procedures actually can get their astigmatism corrected as well. So oftentimes, depending on how much astigmatism correction is needed, there may be some caps in, the availability of certain contact lens brands or something. But yes, all types of astigmatism can be corrected with glasses, contacts, and possibly LASIK as well.
And he has the same question, like, what is the best surgery suggested for dry eyes with the healthy cornea?
So that there's actually a number of, so it wouldn't necessarily be a surgery for dry eyes. There are other things that one should try before going into something like a procedure for dryness. There are a number of things out in the market that you can try after you have tried artificial tears, warm compresses, and getting enough water. There's actually prescription drops, something like Restasis, Xiidra are out in the market that will treat inflammatory dry eye. So if you've exhausted other things, then those would be the next steps. And then if those are still not working, there's other things like amniotic membranes, which is something that would cap the corneal surface if it's healthy enough. There's other procedures that are like laser procedures that can be treating your meibomian glands, which are little glands that line your upper lids, your lower lids, and they produce the oily secretion that keeps your tears on your eyes longer. And so oftentimes people just need like a laser procedure to open up those glands again. So, the best thing would be consult with your optometrist, your local optometrist first to see what sort of dry eye you have, because that will help them figure out how to target it better. Some people have inflammatory dry eye. Some people have, meibomian gland dysfunction. Some people just are not producing enough tears. So it will depend on the type of dry eye, but then they'll be able to kind of go through the steps necessary to get you feeling more comfortable and producing enough tears and keeping those tears on your surface longer.
Thank you, Jessica. And we have one more question. Can conjunctivitis harms eyes?
Conjunctivitis?
Yes.
Yes. So conjunctivitis is actually inflammation and it's an infection of the eyes. So there's bacterial conjunctivitis and there's viral conjunctivitis. So that's oftentimes what people call pink eye. Pink eye is a type of conjunctivitis. So if it is bacterial in nature, it can be treated with eye drops. And again, those would be prescription eye drops coming from your eye doctor. If they find that it's not bacterial and it's a viral conjunctivitis, then just like a viral cold, it's something that will have to run its course. You can do things like artificial tears and cool compresses to make you more comfortable in that healing process. But unfortunately, viral conjunctivitis is one of those things where it's going to have to run its course. But things that you can do, because sometimes conjunctivitis becomes very popular, in the school system. If one kid gets it, the next kid gets it because it's highly, highly contagious. So what you'll want to do if your child starts to show any symptoms of that red eye, pink eye, right? Sanitize all doorknobs and surfaces that are touched frequently by members in the household, and then wash all their bedding and pillowcases and things like that, and then try to keep them from rubbing their eyes and touching other things because again, the conjunctivitis, especially if it's viral, can be highly contagious.
Yeah, we have one more question.
Yeah.
Does one eye has both long and short sightedness?
So only when you develop presbyopia is that possible. So typically, if somebody can see well far away, but then they develop presbyopia, they won't be seeing up close in both eyes, right? But if somebody is not able to see far away, when presbyopia comes around, they will not be able to see up close as well. So they might be in a situation where they are like taking their glasses off to see, or they're holding things further to see. So presbyopia is the only time where you could have a combination of the near and far sight because of the presbyopia development from the muscles losing their function at around 40. Before that, it's only possible to have one. Now, both eyes can be different. So one eye could be hyperopic, one eye could be myopic. That is possible.
And we have a question from Sri Cherupalli. Is LASIK recommended for population over 50 years of age?
That's a very good question. So LASIK typically is not recommended if your ultimate goal is to get out of glasses forever. After 40, I would say, because typically with LASIK, they're only going to be able to correct you for your distance vision, but then you have that presbyopia development. So then you will still need reading glasses if you were to get LASIK. They will correct your distance, but then you're going to be reaching for those reading glasses if you're after 40. Now, there is new technology being developed where they're trying to target presbyopia with LASIK. So stay tuned. But I would say as of right now, with the current technology, I typically don't recommend my patients to get LASIK if their ultimate goal is to get out of glasses, period. If you have a strong prescription for distance and then you're like, I don't mind wearing reading glasses if I need to, then I would say go for it.
Yeah, got it. And we have a question from Sada. What are the corrections for Stargardt disease and low vision?
Very good question as well. So back in my first slide, I did mention low vision, and Stargardt's is one of those things where it's a condition where it is going to slowly deteriorate vision and cause maybe issues with nighttime vision as well. So I would advise you to see a low vision clinic specialist, first of all, because those are where you will be able to see what vision do you have and how can we maximize that. So was the question, what is the treatment?
No, they're asking for the Stargardt disease, and you can tell what are the treatments. People will come to know, right?
So unfortunately, the thing is that there's no treatment for it right now, but low vision is what's going to help you maximize the vision that you do have. So they're going to offer you, instruments and devices that will possibly enlarge things that you're looking at, right? So it'll be like maybe something that looks like your phone, but it acts like a magnifier. And so you could hold it over everything that you're reading if your up close vision has been affected. So seeing the low vision specialist is what's going to offer you, what can we do to maximize vision? But unfortunately, there's not going to be like a treatment like, hey, we can do this laser procedure, we can prescribe these drops. Unfortunately, with Stargardt's, there is not that option.
Okay. And we have a question from Arun. Does every human get cataracts at some age in their lifetime?
We do. Yeah. So typically the average age is somewhere in our 60s and 70s. How fast it's going to progress for people is what varies. And so that's where, the sunglass plays a role. So wearing your sunglasses, protecting your eyes against UV, that is what's going to help keep the rate of cataracts progression slow. But yes, we all do develop it. It's just how fast it progresses is what varies.
And Aparna just want to know like how the eyesight decreases, like based on the age.
So that's where it's in environmental factors, genetic factors, aging process of the eyes as well. So if the question is specifically maybe geared towards children, unfortunately, as children are growing, their eyes are growing as well. And so myopia can, become worse as they're growing because the eyeball is growing as well. But again, children who are spending more time outside earlier on, they're going to be less likely. Children who have a parent that doesn't have correction, or parents that don't have correction, they're going to be less likely to, develop it or have it progress. But unfortunately, with kiddos, eyesight will progress as they get bigger. And then for adults, everyone will experience that presbyopia change around 40 as well. And then again, around 60, everybody will develop cataracts, and that will impact vision too. So, the things that we can do, again, is just protect your eyes, give your eyes breaks, eat a well-balanced diet so you're protecting your retinal health, things like that. But in terms of that prescription development, it's sort of genetics and environmental factors.
Yeah. And we have a question from Elubandi. He has a 7 years old, it seems. He got glasses. So asking, is that due to screen time? He heard due to mind development, and his question was not proper actually. He's asking like, will reducing the screen time helps not to increase the point?
Yeah, so that's a very good question, and I'm glad you asked at age 7, because like I said, so it's they're finding that children who are spending more time outside up until like 12 years old at least are less likely to develop myopia and have it progress as quickly. So there is no guarantee of how much it might prevent it from, decreasing the power. But yes, spending more time outside and decreasing screen time will increase your chances for less development of that power now that he's got the glasses.
And we have question from Bharat. He's worrying about kids' screen time. Understand better to avoid both TV and iPad, but these days it's very difficult to stop them. Which one is more harmful for kids' eyes, either TV or iPad for kids' screen time?
The iPad is going to be more harmful because it's including near work. So the TV, as long as they're still sitting far away, the TV would be less harmful than the iPad in that scenario.
Yeah. For little kids, due to screen time, apart from vision problems, can you briefly touch upon its effects on brain development?
Yes. So actually, with the screen time, and I'm not an expert in the brain development, but just research in blue light in general is indicating that the blue light is harming things like melatonin, which is responsible for us getting proper sleep. And as you guys know, kids need their sleep. They're growing and they need all the sleep that they can get to grow. And so it's going to cause disruption in their sleep cycle, which is then going to affect, their overall growth and development. So that's a big role that it's playing, because if you're not getting the proper sleep and you're not properly growing, that's affecting your brain growth as well.
Yeah. And we have a question from Aparna. So what are the ways to decrease your eyesight for kids?
So again, it goes back to, spending more time outside, less screen time, giving them more regular breaks, and follow the 20-20-20 rule when you are doing screen time as well.
And we have one more question. What are the flashers and floaters and how to treat them?
Good question. So flashes and floaters. So floaters are, I would like to go back to my diagram here so I can explain it a little bit better. So floaters, are you guys able to see my mouse wiggling on the screen too, Deepthi?
Yeah, yes, you can see, you can able to see.
Okay, so floaters are actually little clumps of protein that develop in this part of the eye that my cursor is waving around. That's the jelly part of our eye that helps keep the eye in its shape. And over time, we get little clumps of protein because as we all age, that jelly component starts to get clumps of protein, and then they float around in the eyeball as the eyes are moving. And so what floaters are actually is little protein clumps here. And what you see them is as shadows in your vision, because based on how the light is entering and then bouncing back from the retina, you're seeing a shadow of that protein clump as a floater. Now, what we worry about is any increase in floaters or flashes, because what that can indicate is this vitreous, which is that fluid again, if it's tearing away here from, the retina and pulling a retina with it, that can be a sign of a retinal detachment, which can cause permanent vision loss. And so that's where your eye care provider might always ask you, are you having any flashes or floaters? Because normal floaters that come and go, that's fine. But if you're all of a sudden having a lot of them and they're coming by flashes, the flashes is that tugging that's happening that might be tugging away the retina too. So that's what you want to look out for.
Thanks, Jessica. And we have one more question. From Sai, do we need to change our spectacles even though sight did not increase?
That's a good question. So if your power is staying exactly the same, it will all come down to the condition of your lenses. Over the course of time, we can develop little, wear and tear on our lenses. We can have little scratches developing. We can have sometimes the coating starting to peel off. So if your condition of the lenses is A+, then hey, you might not need an update. But if you're the average person that has a little wear and tear on the lenses, those little, scratches can impact vision because it would distort light more as light is entering through glasses that are not perfectly clear anymore. It's going to distort light and cause you to see not as clearly.
Yeah, we have a question. Can a person have both myopia and presbyopia? What can we do to improve?
Yep. So myopia and presbyopia, yes, you can have both after the age of 40 once you develop presbyopia. So I will take myself for an example. I have myopia right now. I wear contact lenses. So yes, when I get closer to 40 and start developing presbyopia, I will have myopia and presbyopia. My options to correct at that time would be glasses that are bifocals. So they will have the distance correction and my reading correction. And my options at that time will also be contact lenses that might have multifocal contact lenses. So they will have the reading power built within them so I can still see up close and then still see far away. Another option that some people with myopia have, depending on the power, is simply remove your glasses and then you can see up close. So those are essentially your three options if you have myopia and presbyopia. Unfortunately, there's no way to prevent it.
Yeah, that's true. And here is one more question we have. No matter how old I am at this moment, it's always good to be prepared. What eyesight changes can I expect as I age?
Did that person provide an age?
47.
47. Okay. Yeah. So things that might show up for that person again is that presbyopia, needing reading glasses maybe. But other things that you can just do on your end to keep your eyes protected is really going to start to be wearing your sunglasses more if you haven't been, so that the cataracts doesn't progress as quickly when it does develop for you. Eating a well-balanced diet. So again, green leafy vegetables, colorful fruits, omega-3s in your diet, that's all going to preserve your macular health. Your macula can take a hit sometimes as we age with something like macular degeneration. So that's where, again, eating a well-balanced diet will preserve your macular health. Stay active. Regular exercise is shown to reduce your risk of developing macular degeneration as well. If you are a smoker, I would try to quit or reduce because that's going to play a role in your cataracts development and your macular degeneration development as well. And then just make sure you are getting regular eye exams, even if you feel like you do not need glasses. Again, it's those systemic conditions that show up in people, or it's these other issues that we're not able to see at home. And we may be not having any symptoms at home, but getting routine eye exams will help us make sure that there's not indeed something going on that we're missing.
Yeah, let's take, I think so far we are, I have one question. What is the best refractive surgery technique suggested for dry eye with eye farsightedness, that is LASIK, PRK, SMILE?
So that will depend on your corneal thickness. So that is going to be a good question to ask your eye surgeon, actually, because it will depend on the measurements that they get for your corneal thickness. And it's also, again, going to depend on the type of dryness that you have. So diagnosing if it's inflammatory in nature, if it's related to you not producing enough tears, your meibomian glands. So again, I would touch base with your eye care provider because it's a little hard to answer unless we have your actual data.
Yeah. Thank you, Jessica.
Yes, no problem.
We completed the question and answers. Thank you for your time. You've been patiently answering all the questions. We got some overwhelming response from all the audience.
Yes, of course, no problem. I'm glad there was a lot of good questions, and I'm glad to know that there were some curious people in the audience. And thank you everyone for tuning in. Hopefully you got something to take away from here that you can start to apply in day-to-day life, whether it's just going in for an eye exam, reducing your screen time, getting outside with your kids a little bit more, changing up your diet a little bit more, something hopefully that somebody, all of you can take away. And thank you again for having me, guys.
Yeah, thanks for sharing your knowledge and your extensive experience in the eye-related diseases. You explained very well. And I request Vijay to say a vote of thanks.
Hi, Jessica. Thank you so much. Our heartfelt thanks for sharing, invaluable and insightful information, and also very good guidance for our health. I'm personally amazed with all the diverse questions we have received, and you have addressed each one of them. So, which is seems like you have covered pretty much that anyone of us could have not got these answered in our one-on-one appointments. So yeah, thanks a lot, Jessica, for taking your valuable time and supporting us. Much appreciated, very much appreciated.
No problem. It was my pleasure.
And I think we wanted to definitely thank our participants who has been very nice in asking these questions and make it more reasonable for this webinar session. So I appreciate all the participants as well for joining.
Yeah, lots of great questions. I agree.
Yeah. Dipti, over to you.
I would like to express my thanks to our EC members, CDs, BODs, and RVPs who joined in the call, and all the participants for attending the webinar. And I would also like to thank everyone for asking the important questions. And thank you, Jessica. Thank you for your time, and thank you for accepting our webinar request. And thank you for being patient in answering all these questions.
No problem. It was my pleasure. Thank you for having me.
Yeah, I think we can stop the seminar then. YouTube.
All right. Good night. Have a good evening, everyone.
Thank you. Bye. Bye, everyone.
Bye.
Thank you.
Thank you, everyone. చెప్పండి అన్న మీ క్వశ్చన్ వినిపించట్లేదు